Hello and welcome to the Oath and Staff podcast. I am A. David Singh, bringing you stories from people of medicine who serve humans and animals in unique and wonderful ways. In today's show, I'm talking to neurologist Dr. Sudhir Kumar. Sudhir and I share a long history, first as medical students at CMC Vellore during the 1990s. Later, when I was a medical intern, Sudhir was training in general medicine. While working with him, he taught me the practicalities of efficient and ethical patient care, for which I remain grateful. Our paths crossed years later when I began my neurosurgical training. At that time, Sudhir was in his final year of neurology residency. Even though he was in a medical specialty and I was in a surgical specialty, neurology and neurosurgery at CMC Vellore were housed under the same department called the Department of Neurological Sciences. So we met quite often in the wards and the intensive care unit. After leaving Vellore, Sudhir has gone from strength to strength in his career and is now a senior consultant and professor of neurology at Apollo Hospitals, Hyderabad, in South India. Welcome, Sudhir. Welcome to Oath and Staff.
Thank you, David. It's my pleasure to be here on your show. And as you mentioned, we shared a great time at Vellore. I also have been following you, and you have done lots of other things. Being besides being a neurosurgeon, including being an author. So it's my pleasure to be on your show.
Thank you, Sudhir. Let's kick things off at the beginning. What got you started in medicine and later in neurology? Is there a story behind why you decided to become a neurologist?
Yeah, it's very interesting. So let me take it one by one. First, why medicine? We are a family of engineers, so including my father, his brothers, my mother's brothers. So my parents said we need one doctor. And since you are a bright kid, bright student, we know that you can manage medicine. So I was chosen for that. I wrote the various exams, including CMC Vellore. And when I got selected, there's no looking back because CMC Vellore has one of the best reputations, and it was a dream come true. So that is the part of joining medicine. And regarding neurology, again, very interesting story. Basically, I wanted to stop after MD medicine and then go back to Bihar and start practice there. But then I thought after finishing MD medicine, I was confident of managing almost all the specialties, but I knew nothing in neurology. I thought, let me join the Department of Neurology, work for 6 months or so till I get to learn how to manage patients, and then I'll go back. But after finishing 6 months of it was time for entrance exams in the DM neurology, and my teachers there they suggested, why don't you just write the entrance anyway? There's one DM seat. Most likely you may not get the seat, so then you can go back. And as luck would have it, I got selected. So then that's how I became a neurologist.
So you were working at Vellore before you joined up for your residency, is it?
Yes, I had a long stint at Vellore. It was almost 15 years. In 1989, I joined as MBBS student. And then after MBBS, I also did MD General Medicine. And then I joined the department as non-PG. And then this DM entrance exams came and I got selected.
That's wonderful. And that's where we met in the Department of Neurological Sciences.
Yes, yes.
I remember I used to bring some cases to you to discuss when you were in your final year of residency and you were very patient with me. I was just a newbie in the department. So thank you for helping me out in my initial days.
Yeah, it was pleasure.
So, Sudhir, now that you're working in Apollo hospitals in South India, could you tell our listeners and viewers what a typical day at work looks like for you?
Yes, after spending 15 years at Vellore from 1989 to 2004, I shifted to Hyderabad. So as you can understand, when you are a junior person, 3 to 4 years post DM, I had to work longer hours, so right from 10 a.m. up to 8:39. But as I became more senior, especially now in the last say 5 to 10 years, so my day begins at around 9 o'clock or 9:30 when I start my OPDs, and then we have patients in the wards, including ICUs. So I go for rounds and see them along with my residents. Then so PD will be going on till 4:35, And after that, I'm back home. That's my usual routine currently for the last, say, 5 to 10 years.
Thank you for sharing that. And now let's dive right into the reason why I'm excited to talk to you today. In addition to being an eminent neurologist, you also have a passion for educating patients about lifestyle diseases and how to prevent those diseases. But before we go any further, let me tell you a story in which we go back to the 5th century BCE to the island of Kos in ancient Greece. At that time, disease was considered mysterious and survival a matter of divine favor. If someone had a seizure, that was a curse from the gods. If a plague swept through the city, it was seen as punishment for collective sins. This is where we meet Hippocrates. He was a doctor, but unlike his contemporaries, he questioned everything society believed about health and healing. He walked the villages and farms of Kos, where he watched and he listened, observing people, how they lived, what they ate, when they fell ill, and how they recovered. He began seeing patterns that disease followed climate, diet, quality of life, and daily habits. That fevers had stages and infections spread from one home to the next. And then he did something revolutionary for his time. Hippocrates began to share that knowledge, not just with fellow physicians, but with common people. He spoke in public squares, marketplaces, sometimes even in the middle of fields, explaining to farmers how bad water caused stomach illness and how certain winds carried fevers. He advised towns to relocate burial grounds away from drinking wells. He taught citizens to boil water during plagues. He spoke about eating a balanced diet, exercising, and the importance of rest. By doing that, Hippocrates dispelled prevailing myths and superstitions about health and disease. Disease is not a punishment from the gods, but a natural occurrence, he would tell the gathered crowds. And knowledge of your body is not reserved for doctors alone, it belongs to each of you. What Hippocrates was doing was unprecedented, teaching the public, giving them tools to understand, to think, and to prevent diseases. There were skeptics, of course, those who mocked his approach, but the regular people, they listened to him because he explained medicine not in the language of the elite, instead, in the language of experience and common sense. Hippocrates also trained traveling physicians who would journey to villages and towns across Greece. These doctors carried Hippocratic teachings about prevention of diseases. True to their teacher Hippocrates, they would gather people in village squares and teach them about sanitation, nutrition, and exercise. By the end of his life, Hippocrates had achieved something remarkable. He had educated the public about their own health and thus created an empowered society. Sudhir, when we were talking about getting you on the show, I had explored your platform and I was amazed that you have over 100,000 followers across different social channels. As someone who carries the torch lit by Hippocrates in the 21st century, you blend lifestyle medicine with education, thereby equipping people with the knowledge to take charge of their health before disease ever starts. That is a tremendous service to your own patients and to humans around the world who see your content online. Thank you for doing that. And now, will you please tell us a story behind how you got started educating people about lifestyle diseases and their prevention?
Yeah, thank you, David. It's a very important question, and this topic is very dear to my heart. Now, if you look at this concept, normally anyone would think a doctor, especially working in a corporate hospital or a private hospital, will want more number of patients. but I am different. I wanted to have less number of patients, and I'm still waiting for a day when I will have no patients to see. When I go to hospital, and when my secretary says, "Doctor, there are no appointments for you," so that would make me feel that this world has become healthy, and nobody is a patient. We all have been taught prevention is better than cure, but why it is not happening? As a doctor, I saw my first patient in 1994. So now we are in 2025. That makes it more than 3 decades, and the number of patients, not only for me, all over the world have increased. The number of doctors are going on increasing, the number of hospitals are increasing, number of beds are increasing, and we take pride in saying that we have more doctors, we have more hospitals. But should we take pride in that? So what I thought, why can't we have a system, or why can't we do something when we have less number of patients? So how can we reduce the number of people falling sick? What can we do so that people do not become patients? From that point of view, when I realized many diseases are caused by lifestyle factors, and many of them can be prevented. If you look at the top 3 or 4 common illnesses like heart attacks or strokes, or diabetes, high blood pressure, many of them uh, we can prevent. So we know that there are many people who advise about lifestyle, like fitness gurus, yoga gurus, and dietitians. But of course, they all do their part. But being a medical doctor, we have little better understanding of human diseases and how they happen. But most of the doctors are busy taking care of their patients. So this part gets neglected. And if you look at our medical curriculum also, our textbooks are typically learn about a disease, symptoms, signs, causes, diagnosis, and treatment. But prevention, nothing is there. And when somebody comes to us, they already are a patient. So our job starts at diagnosing an illness and then taking care of them. So I thought, okay, let me do my part and educate public about how they can prevent illnesses, and that's how I started. All my social media things began only about 3 to 4 years back. When I started sharing these kind of contents, I saw that many people were liking it. So I post things which can be useful to general public and in simple language about diet, exercise, and importance of sleep. Sometimes very specific things about specific diseases which can come in handy.
Sudhir, have you noticed that once you put up a video on YouTube, you get certain comments and questions from people? Has that ever sparked ideas to produce new videos?
Yeah, definitely. When we are educators, we also have to look at public or people who are following us, what they actually want. A lot of people who want to know what vitamin B12 and other nutritional deficiencies. And nowadays, many people are concerned about young people dying of heart attacks in gym and while running marathons. And then in India, there have been a lot of viral videos of young people dancing on the stage and suddenly having heart attacks. And then many people have concerns about post-COVID and vaccine-related adverse effects. So many people do, look for our opinions on these very, very important topics, and these ideas I get from the comments.
What are the common lifestyle diseases that you come across in your practice, and what advice do you give to those patients who are at risk of developing those diseases?
Yeah, very important. We see that overweight and obesity in the last 2 decades, it is no longer confined to the Western world. I see many people in India, 40% of adolescents, children, adults, they are overweight or obese. And as a result, other two metabolic disorders, diabetes, high blood pressure, 1 to 2 out of 5 people, they have these illnesses. And then if you extrapolate those two to heart attack and strokes, the incidence actually has gone up despite a lot of awareness. We are seeing younger people getting heart attacks and strokes. So it is possibly related to the lifestyle and also sleep. So sleep deprivation, almost 40% people do not get proper sleep. These are the common things that we see.
In addition to prevention of diseases like stroke, diabetes, high blood pressure, heart attacks, you have also spoken about the prevention of cancer on your YouTube channel. I was quite intrigued to see that video of yours. Would you please share some insights with our viewers and listeners about the prevention of different types of cancers?
Yeah, definitely. The top 3 or 4 common causes of death and disability, other than heart attack and stroke, cancer is the leading cause. If you look at women, breast cancer, cancer of the cervix, still common in India. In men, lung cancer, cancers of the liver, gastrointestinal tracts, colonic cancer. And then when I'm looking at the risk factors, because I'm interested in prevention and the lifestyle, I realized that many of the same risk factors which work towards say diabetes, heart attack, and strokes, they also work for cancers. And I was surprised to find that obesity is one of the commonest risk factors for cancer, which can be prevented. And then unfortunately smoking in India, it has been common for last several decades. Even today young people smoke. Smoking is a risk factor for many cancers, not only lung cancer. Almost all cancers in the body, they increase because of smoking. Alcohol, literature they say that small amount of alcohol is good, but today as per WHO and many other scientific bodies, no amount of alcohol is safe, and alcohol is a risk factor for several types of cancer, not only liver cancer. We talk about development, but development brings many other problems, and one of them is air pollution, Delhi being the pollution capital of the world. So air pollution is one of the risk factors for many illnesses: hypertension, diabetes, strokes, heart attacks, and also cancer. And many of the preservatives and coloring agents could be also one of the causes of cancer. We know that plastic is harmful, and we are trying to do away with the plastics, but despite so many laws and regulations, it is not being followed. Not only the major plastics, but microplastics. So microplastics, many studies have been done, and they have shown that vital organs, there is a deposition of microplastics, and that not only they increase the risk of strokes and dementias, but they are implicated in few types of cancers. And cancer of the cervix is caused by human papillomavirus. There is a vaccine for it, and government of India is promoting it. So hopefully we can reduce the risk of cancer of cervix. And similarly, breast cancer, mammography, and few guidelines are there. So these are some of the cancers which are unfortunately common.
Thank you for sharing those insights with our listeners and viewers. I am sure everybody would find that immensely valuable. And now, let's go back to the favorite phase of my life as a medical student at CMC Vellore. Many of my batchmates had favorite teachers whom they admired. So I wonder, did you have a favorite teacher in medical college? Also, tell us the story how they influenced your medical career.
Yeah, David, MBBS is a time when from kids suddenly we become adults. From the protected environments of family and parents, we come out in the open, and then we are on our own. And especially for me, because I came from a state all the way to South India, so new language, new culture. I was a good student in school, but somehow in college it was a different ball game. We used to have weekly tests in physiology and biochemistry. Somehow I was able to manage, but anatomy was not my cup of tea. Flunked all the weekly tests, and in the university exam of the first semester, I got the pass marks. And we had an angel, a teacher in anatomy, Professor Mary Jacob, well known to all of us and well respected. She made a real difference in my life, and a lot of credit of my future, goes to her. So normally teachers meet only the best students of the class, but she had a unique thing of calling the best as well as the worst. After the anatomy one, I was in the group of students who had done the worst in the university exams. And she asked me, Sudhir, what is your problem? I have seen your answers. She pointed out that my English is very poor because I had studied mostly in Hindi medium, and our conversation also was in Hindi. So I used to find a lot of difficulty in writing the sentences. Then she asked me, which books do you read? So I said, I read Chaurasia. I told her the truth. She said, no, 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 that is not the correct book. She suggested good books like R.J. Last, Grant. And then she said, if you are very good, then you can even look up Grace. But before that, you should improve your English. And she invited me to her home and gave me two or three English novels and said, Sudhir, when you find time, read them, because only then your English will improve, and then teachers can understand what you're trying to say. She was like a mother. I never expected a teacher to talk to a student who has almost failed in the exam with such nice words and suggestions. So then I thought, if my teacher is so concerned about my success, the least I can do is put in my best effort and try to improve. So in the second semester, I was a different student, and I looked up those books, Grants and R.J. Last. I didn't have the courage to look at Grace, and I also read Chaurasia. I won't lie here. And then when the exams came, I wrote the exam well and got the highest marks in anatomy. Again, I was called by Dr. Mary Jacob to her chamber, but this time I was in the top five students. So the credit goes to her. How to make students who are the worst in the batch become one of the best. And then I got my confidence back, and then the next 3 years just sailed through.
That's a wonderful story. Just like Professor Mary Jacob influenced your life and career, I am certain that you have also positively impacted generations of trainees who had the privilege of working with you. Today, what advice would you give to medical students and internists who are considering neurology as their career?
Yeah, David, it's very interesting. People feel that the medical career is not so charming anymore, but I disagree because even after 3 decades of being a doctor, I still enjoy my work. There's no better feeling to see a person who's crying or who's upset get better and then go with a smile. It is not only the treatable diseases, but there are some conditions we know that we cannot cure, but even there we can make a difference. The way we deal with the patients, the way we talk to them, we give them hope, we listen to them. Listening is one of the most valuable things we do as doctors. Many patients tell me, the doctor, I know that there is no treatment for this, but you listen to us and you have a smiling face, so that makes a difference. My advice to junior doctors is that the most important thing is listen to your patients, because patients will tell you the diagnosis when you listen to them. You don't have to stop them and put our questions, so just listen to them. Second thing is, if they have any concerns, questions, resolve them, answer them. This, they are already in pain, they are having troubles. So at that time, if we show our kindness, it's not kindness, it's part of our job. And thirdly, be truthful. Sometimes we have difficult news to break. Grade 4 cancer, where outcome may not be good. So we should learn the art how to convey the bad news in a proper manner. Analyze the family, the person, how much they can take, and if possible, break into two or three different meetings. If everything cannot be covered in the first session, so this makes a difference. I've had patients with ALS or MND who have come and thanked me when I told them there is no specific treatment to cure you. But the fact that I was able to listen to them, I could tell them what to do and how they can manage better. So we should be patient and answer them. And medicine is a very charming specialty. Neurology is also very very unique. I love neurology because in most specialties, it is lab oriented or investigation oriented. Nobody can diagnose hypothyroidism without seeing a TSH. You may be knowing all the clinical symptoms and signs, but you need the TSH. You cannot diagnose diabetes without having a blood sugar of more than 140 or HbA1c more than 6.5. Patient may be having all the symptoms. You cannot diagnose renal failure unless creatinine is high. But fortunately for us in neurology, the most common conditions, we don't need to do a test. Migraine, almost 15% of people suffer from it, but diagnostic criteria is based on the symptoms. Similarly, epilepsy, half the cases of epilepsy, the EEG may be normal, MRI may be normal, but the description of the seizure, it helps us make a diagnosis. So it is still one of the old-fashioned specialties where we need to listen to the patient, examine the patients, and then come to a diagnosis. And the tests, they only help us confirm the diagnosis or exclude some other causes. So that is the beauty of neurology.
Thank you for sharing your advice. Let's go a little deeper into some of the things you've just mentioned. The significance of neurological history and examination was drummed into us during our training at CMC Vellore. I remember you talking to me about this during the first few days of my neurosurgical training. However, when I left Vellore to work in hospitals abroad and in India, to my dismay, I noticed that history taking and examination were not being given importance to. Sudhir, in your own words, would you please explain why a detailed neurological history and examination is critical in the effective treatment of patients? This question is again focused at medical students and neurology and neurosurgery trainees.
Yes, David, very interesting question. And here I will do a little bit of give and take between neurology and neurosurgery, even though at Vellore, as well as in Apollo Hyderabad, where I work now, It was a department of neurosciences where neurologists and neurosurgeons we work together. But somehow, there are some neurosurgeons who look at the scan, your scan is normal, nil neurosurgery, nothing is required. But the patient, still is unsatisfied, because as a doctor, we need to tell the patient what the problem is. It matters to a neurosurgeon whether surgery is needed or not. But the patient has come with a problem, and patient needs to know what is the disease and what can be done. So that is where history examination are important. Second thing of importance is, suppose somebody looks at the scan. Let's say there is a small disc prolapse in the lower lumbar region. If you do 100 scans, 10 or 15 may be having that. But is that causing a significant symptom to the patient or not? History examination are important there, because if the slip disc is causing symptoms, then doing a surgery will be helpful. I know many neurosurgeons who take very good history examination, and they're as good as a neurologist or even better than neurologists. One of my senior neurosurgeons used to say in Vellore that a good surgeon knows when to operate, but the better surgeon knows when not to operate. And also for neurologists, if we look at the MRI may show some hyperintense lesions. But whether that is demyelinating illness, whether that is stroke, whether that is infection, so that information will get only if we take proper history. How many days the illness is there, whether it started all of a sudden or slowly. So both for a neurology resident and for a neurosurgery resident, and even for a medical student, history examination cannot be replaced.
So that's wonderful. And that has been my experience too. When I was a trainee at Felor, our morning rounds used to consist of about a couple of hours in which the resident or the trainee would present the neurological history and examination findings to the consultant. And at the end of each case presentation, the first question the consultant would ask, what is the anatomical localization? And based on the history and examination, we as trainees had to tell them where the lesion is located. And that was very important because on clinical examination and history, if we can localize a lesion to a certain point in the brain and spine, we have to then compare that with the patient's MRI to see if there's an abnormalities in the same point. Suppose there's an abnormality present there, then we are certain that that particular abnormality is causing the symptoms, and hence a surgery of that abnormality would alleviate the symptoms. So that's very important. I feel history taking and examination should be at the forefront of all medical training programs, irrespective of the specialty. And now let's come back to prevention of lifestyle diseases. What activities do you do to prevent lifestyle diseases in your own life?
Yeah, David, that's very interesting. I must share that, because throughout my childhood, I was a motu. I was known as fat and obese. Initially, I used to feel upset, but then I thought, anyway, I'm fat. Today, of course, it is called as body shaming. But when we grew up in 70s and 80s, this concept of body shaming was not well known. So we all were body shamed. When I finished my plus two, I was 82.5 kgs. When I entered MBBS, and then subsequently, by the time I finished my DM neurology, I was almost nearing 100 kgs. And it was partly because of hectic lifestyle, which you are aware of. In Vellore, we all had to work for 16 to 18 hours. There's no other option. And then, so all work, overeating, no exercise, no sleep were the recipe for lifestyle diseases and obesity. So as a result, I had become overweight. My HbA1c had reached around 6. I had high cholesterol. So then, about 8 years back, I started slowly. And in 2020, when there's COVID-induced lockdown, when we had no patients, no work, and that's when I took up running as my passion. So I was never a runner. You know that in college also. And then I decided to sleep at least 7 to 8 hours. I cut down my work and research papers. So that freed up 2 3 hours of evening time. I could sleep by 10:30 and get up by 6:30. And I decided to stop having soft drinks, sugary drinks, juices, packaged fruit juices, and lots of sweets. And then out eating out. So the weight that was 100 kgs dropped to around 70 kgs. That's a major change. I also started gymming, so 2 3 times in a week strength training. and HbA1c is 4.8. If we make a decision to adopt a healthy lifestyle and work towards it at any age. When I started, I was around 49 years of age. Today I'm 54. So, if we can rectify all the mistakes that we were doing earlier, it is possible to see changes. It gives us more confidence, and then we are also able to help other patients who are suffering from similar issues.
Thank you for sharing that. I'm sure doctors, especially younger doctors who spend long time in patient care and research, will find inspiration from your personal story. And now, would you tell us what's the one thing that you'd like to change about how neurology is practiced or how neurology is taught?
We were lucky to have trained at CMC Vellore. We had great teachers. We had one professor, she was very good in history taking, another professor who was very good in clinical examination, and the third one who was very good with theory and everything in Bradley or Harrison's. It was at his fingertips. So there are three different ways, good history, good examination, and then good in theory also. What I feel is combination of all three is required definitely. And when I took up neurology in late 90s, my other professors departments like hematology and gastro, they used to feel sorry for me. They said, Sudhir, you are taking up something where there is no treatment. You'll be discussing for 1 hour about localization, and then you'll write some vitamins and then send the patients away. But in the last 25 years, a lot of therapeutic advances have happened in the field of neurology. We are having more effective treatments, not only for stroke, we have thrombolysis. Immunotherapy has come in a big way. So neurology, we have to go beyond history taking and examination. All the recent advances, especially in the field of immunotherapy, genetics, newer imaging, we have amyloid imaging, functional MRIs, video EEG, correlation with the clinical seizures, PET, and the MRA findings, administration of botulinum toxin. It was not included in our curriculum, and I don't think many places they have it. But patients will come with movement disorders, and we need to inject botulinum toxin. So practical things beyond history taking an examination, these things which can be treated. I made a list. Almost there are 600 disorders in neurology which can be treated. At least about 300 of them can be taught during DM, and of course we can keep learning after that also.
Wow, thank you for sharing that. What legacy would you leave for the specialty of neurology and lifestyle diseases once you retire?
We have many subspecialties in neurology. We have stroke neurologists, movement disorder specialists, epilepsy specialists. I would like to be called as a preventive, neurologist. I feel that if you are able to prevent an illness, it is better than treating a person who's already got the illness. Today, one person consulted me. He had derangement of a few blood parameters like HbA1c and lipids and homocysteine. He had read one of my posts and he knows that these are risk factors for stroke. So he came to me saying, Doctor, tell me how to manage this so that I don't get a heart attack or stroke later. So that is what I want to do. And if I can prevent few persons from becoming patients, I have to consider myself successful.
Sudhir, many thanks for spending time with us on the Oath and Staff podcast. It was indeed a pleasure to talk to you and very educational for me.
Thank you, David. I also enjoyed interacting with you.
And that's all for today, folks. I hope you enjoyed this episode with Dr. Sudhir Kumar and gained valuable information about your health, lifestyle diseases, and their prevention. Thanks for tuning in and subscribe for more.